Good afternoon, this is Dr. Moein. I'm here with my lovely patient, Rosa. She's here. She was concerned about some contour deformity of her abdominal wall, and she was told that it may be a hernia. And she came over here and wanted to check out and be examined and see if this may be a hernia. She had a liposuction renuvion done in Colombia. She had previous Kybella done on the area and several types of RF to address it, thinking that it may be fat, and if she uses these modalities, she'll be able to resolve it. Right side and left side, there's a distinct difference, and she thinks that this may be caused by a hernia. So what we're going to do is do an ultrasound on it and use our very nifty device, ultrasound, to check to see if this could be a hernia. I like to do this with the patient actually standing, because that puts some pressure, and if there's any hernias, you can see it much better. We will try to have the patient do some Valsalva maneuvers, such as coughing or bearing down, to see if we see any kind of hernia. There's definitely a distinct change from this side to this side that you can appreciate just visually. Can you cough for me? And I don't see anything bulging out. But let's do our ultrasound. When we do ultrasound, the ultrasound is very sensitive in visualizing each layer of anterior abdominal wall. In the midline, you have what's called linea alba. Linea alba is a condensation of the anterior posterior sheet of the rectus abdominis muscle. We come to the side, and we can see that the layering is continuous, both in the upper area and the lower area, the area of concern. And these are sheets after sheets of muscle that is going across, and they're continuous. Weakness. Can you cough over here? The weakness usually occurs on the side. Cough again. When we go to the lateral margin of the rectus, we see the external obliques. So we have completed this portion of our examination, and I can tell that this is just residual fatty tissue and scarring. But this can be corrected by using microliposuction of the area and going in and distinctly trying to just do layers by layers of fat removal from that area. But we try to do our best as cosmetic plastic surgeons to achieve what brings satisfaction to our patients and a level of symmetry that would be acceptable for majority of people. Thank you.